I'm probably not going to go through all details, but I wanted to take a few minutes to just walk through what are some of the key process design features that are needed for autologous cell therapy. And it always starts with begin with the end in mind. Certainly as you think about what we're trying to do and the scale up for the number of patients we want to serve and quality release programs and criteria that establishes good aseptic manufacturing, but also meets all the sterile drug guidelines, is a great starting point for us as we think about growing this product line itself. The other thing I wanted to touch upon is, there's really not a playbook for a lot of these cellular therapies. A lot of companies have been putting a lot of effort towards it. The FDA certainly has been partnering up, and they've had some recent guidelines for cell and gene therapy, but it's still at a very innovative space. So the critical to quality attributes, what do you have to do for release testing? Those are still things that are being worked on. One point I do encourage companies that are thinking through it is to take advantage of working with the FDA. In our case, we did receive RMAT designation, so it gives us the opportunity to interact with the FDA more frequently. And those are areas where it makes sense to walk them through what your process looks like, how you think about unit operations, and what's needed to get to qualification steps itself. Last step I want to touch upon this is in any cell and gene therapy, the starting material is super critical. This pretty much defines whether you're going to have a successful batch, so to speak, and also ensures if there are elements of toxicity or product release criteria that's well identified before it goes to a patient. So those are some of the things that make it super sensitive in how you work with the patient aspect of it, and also the raw material strategies. Everything from chain of custody, chain of identity, to single and sole sourcing. So all these become fairly critical factors in the design of this facility itself. Now moving to the facility itself, I touched upon the product side itself. It's not that easy to put into consideration when you have a significant amount of capital intensivity to produce these type of manufacturing facilities. A simple thing as a location becomes a critical aspect of it. Where do you locate a facility like this that can service patient populations across North America and Europe? And if you're thinking about it from a growth perspective, how do you upscale with it long-term itself? Other things that we learned through the process from a site perspective is utility needs. As we look at clean room infrastructure and having the ability for capital investment, but also from a redundancy and reliability aspect of ensuring these facilities run continuously, those become factors itself.